Hi, this is Reda Setki. I'm the founder of Learning Strategies International, and this is a presentation was first made at the Center for Education and Research for Humanitarian Action of the University of Geneva, a distance learning program. I'd like to share a few tasty tidbits from my experience working with the IFRC's Global Health Team, developing its learning strategy. Starting with a premise that the learning that matters the most, the significant learning, the learning that makes a difference, is embedded into work and is informal and often incidental in nature. What we came up with was a practical method to strengthen informal and incidental learning, and I want to share a few things about that with you. So here is the model developed by Victoria Marsick and Karen Watkins. We work very closely with Karen Watkins and her team on figuring out how to adapt and apply this model to the particular context of the International Federation of Red Cross and Red Crescent Societies, and within that, the work of the Global Health Team, supporting the work of national societies in 189 countries. So the model describes 7 dimensions of learning organization, and it's got a couple of interesting features that made it appropriate for this IFRC context. One is that these dimensions, the people level and the structural level, are also action imperatives. They're also sort of actionable levers. So if you create continuous opportunities, you know that you're helping connect the organization to its environment. And furthermore, you know that this also correlates with improved performance in terms of knowledge performance and financial performance, as well as a third mission performance indicator developed by Karen Watkins and her colleagues, the mission performance. And that was the one really specific to the context of the organization we were looking at, which was, in this case, the IFRC. So very powerful, very interesting model. What's even more interesting is what we came up with and what it gives us. So we used the instrument called the DLOQ, the Dimensions of Learning Organization Questionnaire. And this gave us a very precise numerical measurement along these 7 dimensions of learning culture, showing us what the relative levels, what the strengths and weaknesses were within those dimensions, to give us a feel for, and actually, even though it's statistical data, quite an intuitive and qualitative feel for what was happening with the IFRC's Global Health Team at a particular point in time. So this was benchmarking. IFRC had never had any measure of its learning culture, much less an instrument that enables it to do so. So what you see here is, and you can see along the different dimensions of continuous learning and embedded systems are the low points of that learning culture. But as you go into things like empowered people, or dialogue and inquiry, those are strengths of the team and its work and its learning culture. On the performance indicators, you can see that the mission performance is, as you might expect, the highest of the 3, and that the knowledge performance is the lowest. And again, even though this is a scale from 1 to 5, what's really important to the relative distinctions in their statistical significance, which we're able to demonstrate, even though I won't go into it here. So this gives us a kind of map pattern of the learning culture, and actually proved to be quite a powerful heuristic tool to stir discussion and conversation and dialogue around learning, around the kinds of things, around the problems with embedded systems, starting with email that doesn't work or email search that doesn't function properly, going into more complex sort of knowledge management and outward-facing systems, or the continuous learning, actually being able to capture and share what we learn as we work. Those were some of the considerations that we looked at. Now, the second piece was the qualitative research, as this was mixed methods. And here are some of the codes that we used to analyze the interviews of learning practices, learning habits. So what we wanted to get to was, okay, if most of the learning that happens that matters escapes formal training, happens outside of formal training, is not the learning that's prescribed, organized, or coordinated by the organization, then how do we get to it? So we basically ask people how they learn, ask them what they learned, in particular with a particular focus on the eureka moments. This is also from Karen Watkins' research. describing, trying to characterize the eureka moments as incidents, and getting people in the global health team to describe what they discovered, but then to work backwards from there to actually figure it out how they learned it. And we got some very interesting, very powerful and compelling descriptions of how people in the team solve problems every day. And then that enabled us to think back, well, how does this mean? How does this correlate with with a pattern of the learning culture and what we learned from that? And it's by really putting these together that we were then able to elaborate a set of recommendations for the team. Now, we broke down the 81 final recommendations into by feasibility, risks, and costs. And the first sort of postulate was that if there's a kind of learning that requires you to stop your work in order to do it, in order to go to a training, to do, or even with self-guided sort of kind of learning. In other words, if it cannot be embedded into work, then it's a problem. It's unlikely to be sustainable, especially during emergencies. So it turns out that over half of the 81 recommendations, or 42 of them that we formulated, could in fact be embedded into work and do not suffer from this problem. And this was one of the key sort of guidelines, or so litmus test. You want to do something for learning. Can it be embedded into work? If not, then it's a problem, and we need to look at it and think about what that problem means, if it's to determine if it's worth doing. Second consideration is a budget. Wishing for more, more resources, more trainers, more capacity at this stage is unlikely to happen. So if the learning initiative, the learning recommendation requires a budget, it probably will not fly. So it turns out 86% of the recommendations do not require a specific budget, even though they do require the organization and the presence of a learning function. So it turns out that taking action to support, foster, and reinforce informal learning simply turns out to be very cheap. And that's a very interesting piece of learning for us, and that's significant for the conclusion of this presentation. We also looked at feasibility, priority, and risk, and again, you can see sort of split halfway. Most of the things are higher medium feasibility, higher medium priority, and lower medium risk. So that was also an interesting way to characterize these things. Now, the bottom line, the takeaway, there are two. One is that prior to this work, the IFRC had developed the IFRC's global health team had developed a set of training guidelines, which basically were very good, high-quality guidelines recommending that the quality of training be improved, that the pedagogy be considered more fully, that trainers' pedagogical skills be correctly considered. It suggested setting up country learning teams that could support things at that level. Set of very good, very powerful ideas in principle, but completely inapplicable in the real-world environment of the global health team. So frustration was that calling for more formal training, doing it better, doing more of it, in and of itself is unlikely to produce results, and is not, in fact, feasible from a financial or resource perspective. It cannot justify having people stopping work to go off to training. So the first insight was that the focus on informal learning, once we cracked it, could actually lead to sort of better ways that can be embedded into work and don't necessarily require massive amounts of resources. Now, the second insight and takeaway, I think, in some ways more profound, has to do not with how we do training, but the role we have as learning leaders. Historically, learning, education, and training in the humanitarian space was about prescribing training, figuring out how to get people to go through a sequence of events that would get them to a certain level of proficiency. Very often in very uneven sort of relationships, say, between the delegate from Western Europe and village volunteers in the Red Cross, Red Crescent context. That's quite a powerful model for a number of reasons, which I've discussed elsewhere. But what I'm interested in is if, in fact, most of the learning escapes what can be prescribed, escape, so it can be tracked and measured through traditional forms of evaluation. And if most of the learning, the problem solving, the eureka moments are embedded into work, and we're not involved as learning leaders in supporting and fostering that, then what does that mean? And if we actually want to play a role with respect to how people really learn, and what actually makes a difference in organizational learning, then that's really a profound shift. We're going to have to rethink what we do and how we do it. And this is the kind of conversation that I'm hoping I believe has begun in the humanitarian space, and actually has its own sort of strand and history and of people being frustrated with the limitations of traditional training. What's different this time is that we have these very powerful affordances. We have this amazing economy of effort that we get from technology that enables us to be connected in ways that we've never been able to be connected or as connected before. And that is ultimately the relevance, the significance of technology for humanitarian education, training, and learning. So figuring out how to use technology is already sort of seeped into the fabric of everything we do. And that it has seeped into everything we learn. So figuring out, again, going back reflexively to what is our role as learning leaders is ultimately the big question that comes out of this research. Thank you for listening and taking the time to view this presentation to the end. You can find out more about LSI's work on the LSI website, lsi.io.